So in the beginning, there were 3 colorectal cancer advocates that worked in the research system, and it was me, Kate Murphy, and Pam McAllister. And if there was a scientific committee that needed somebody with colorectal cancer experience, we were the people who were there. Fight Colorectal Cancer, the main reason I wanted it to be here is because to be that squeaky wheel for colorectal cancer patients. And that squeaky wheel can happen at research committee meetings, it can happen at advisory committee meetings, at FDA meetings. It's not just talking about awareness, it's participating in the research process so that you can shape the trials that are going to benefit patients the most. And so we train research advocates to sit on the committees where these research proposals are being developed, where clinical trials are being developed.
As a biostatistician, you have data, and I have not been with patients before, and the stories really, they make it real in a way that I had not anticipated. To an urgency to let's keep going on this, giving you energy. And I'm impressed by the challenges people with colorectal cancer have, particularly younger age, and yet with the courage and resilience that I see.
And as our advocates started to own the mission and the vision, it just became more clear over time that their passion and commitment would keep us moving forward.
Because most people that haven't been through this will not understand. It makes a difference in how you heal and how you fight this disease.
One of the things that I really appreciate about Fight CRC is that they focus on research and advocacy as their 2 primary goals and their primary objectives, because there's always progress. There's always more to do when it comes to research. There's always more to do when it comes to advocacy. And they are there every day working towards that future where there are more treatments available, where there are better public policies. They've got a fire inside of them. They're ready to do something. You know, there's a lot of ways that having cancer can feel defeating, especially when you feel like you're in a losing fight. But when you know that there is more than one way to fight, when you know that you can still fight to give researchers and even policymakers the knowledge and the resources that they need to fight cancer in a number of different ways, it makes it easier to face the reality.
Okay, so this is my reality. I'm no longer in crisis mode. Now I've got a rhythm. Now I'm back at work. Now I want to do something. Now I want to contribute. I want to just be a face of somebody who is stage 4. I think that there's so many people that look like me. Too often, I see all these nurses that come through and they're shocked by my age and my diagnosis, and I don't think that they should be, because it's happening all over the country, right? All over the world. I'm not unique.
I was diagnosed with colorectal cancer in 2013. I was just married to my wife.
I was 26. It was 2015.
And yours was found stage 4?
Yes, it was stage 4.
And how old were you?
I was 31 years old.
I see the young ones come in, the 20-year-olds and the 30-year-olds who've been having these symptoms, and they're getting pushed off with, oh, you just have hemorrhoids, or, you're too young to have colon cancer.
Give it your all, give it everything you can to try to find a cure, to help find a cure, to raise awareness about a cure, to raise awareness to try to get financial funding to find a cure. Our children, our children's children, the more we do now about it, the better it'll be for them in the future.
And I want to be able to tell my grandchild that you don't have to die if you're diagnosed with colorectal cancer. And, I see what happens now and what's happening with the group and with what we're doing in research and everything. It's exactly what I wanted to see happen.
The people that are really fighting cancer are the people whose job it is to cure it.
Hi, I'm Angie Davis. I'm the president of Fight Colorectal Cancer, and I'm delighted to welcome you to our third symposium focused on early age onset colorectal cancer. This year, we called it our Rally on Research because we really wanted to develop and design a program where we could have global thought leaders from around the world, patients, scientists, researchers, and policymakers come together to talk about early age onset colorectal cancer, which is incredibly important in our community, knowing that the numbers are rising and the concern and urgency is rising, not only here in the United States, but around the world. For over 15 years, Fight Colorectal Cancer has been bridging the gap between advocacy and research. And I think that's what is so important about our efforts over the next 2 days. It's really talking about what are the patient stories, what are the policy concerns, and then what can we do in research to improve outcomes for colorectal cancer patients, especially our young patients who are being impacted by this disease. Fight Colorectal Cancer is committed to amplifying the stories of these patients, these young survivors who are being diagnosed as young as their teens. This can no longer be the case. We urgently need to be working together, talking about what can we do together to address the gaps and challenges for these patients. And I think that's why it's so important that we're gathering, not only here in the United States, but bringing global leaders, global thought leaders to come together and really unpack what can we do? Where can there be synergies? Where can we be working together? Because we're gonna have to work together to solve this problem and to really understand why it's happening. I want to acknowledge and bring up the fact that the JAMA article that was recently published underscored the fact that patients don't have time, they're dying, and we need to figure out a way that we could curb that fact, that we will not be the #1 cancer killer by 2030. That is sort of where our heads should be as we're working together, having conversations about next steps. That prediction is unconscionable, knowing that we have an opportunity to make a difference today. So that's why we designed the Rally on Research. We really were very focused over the last year on building a bridge between the scientific community and the advocacy community around the world. It's been really exciting to see domestically US organizations who are focused on colorectal cancer have the opportunity to partner and hear what's happening with our sister organizations. We've been able to be joined by Bowel Cancer Australia, Bowel Cancer UK, Colorectal Cancer Canada, Colorectal Cancer Resource and Action Network Canada, Digestive Cancers Europe, Europa Colon Italy, Lynch Syndrome Ireland, and the Spanish Association Against Cancer. I want to thank all our partners for their time and dedication to colorectal cancer, really meeting with us, planning with us, and crafting this amazing agenda. Over the next 2 days, I hope you will take the chance to have conversations with individuals from all these organizations that are coming and convening together and sharing their stories and knowledge. The fight is truly a global effort. To each of these organizations, thank you for being a part of our Rally on Research. Finally, I'm excited to introduce our hosts, Andrea Dwyer, best known as Andy, and Dr. Jose Perea. Andy and Dr. Perea met several years ago, and Fight Colorectal Cancer had just initiated our early age onset work group. And from there, it really blossomed this idea that we could have this global conversation around early age onset. And we were able to bring researchers together, and what we found was that the issues we were dealing with, everything from taxonomy and colorectal cancer for earlier age onset to the stories of survivors, there were threads of similarities. And I think that their initial idea of pulling a global network together was brilliant. And so as we continue to develop the Rally on Research and focus our efforts on early age onset, I am thrilled that we are convening a global discussion. I think it's going to take a global effort for us to make progress. Thank you for joining us. And thank you for joining the fight against colorectal cancer. By showing up, you are proving that you are a relentless champion of hope.
Hello, everyone. I'm Andy Dwyer with the University of Colorado Cancer Center and the Colorado School of Public Health. I'm delighted to work with Angie Davis, Nancy Roach, and many of you as thought leaders in the Rally on Research, our international symposium, working with the leadership and really the vision of Dr. Jose Perea in Spain. We're really delighted today to have so many people who are joining us from all throughout the world. We have over 30 countries represented today with over 450 people who are registered to really dive into early age onset colorectal cancer, the advocacy component, the patient experience, as well as the research component. And I can't tell you how thrilled I am in this opportunity to really work with all of you over the next 2 days to really talk about these opportunities that we have to advance the research agenda, the patient care agenda, as well as really hear from all of you about your thoughts. So we'll go ahead and move to our next slide. And I just want to say that was a very empowering video. Angie, Nancy, Dr. Ann Zauber, so many of the advocates and patients who have been there. It's just amazing to hear all of the great energy and support for this work. So next slide. Speaking of partnerships and really making today possible, we have over 9 countries represented in the planning of today's agenda with over 20 people from all throughout the globe. This is a very dynamic conference. We're really excited. And I just want to say a huge thank you to Elsa Weltzing, as well as Reese Garcia, who've been really instrumental in helping plan today with Jose, myself, Angie Davis, and all of the members of our steering committee and planning committee. So thank you. You can tell there's people from Australia, from Ireland, from Europa Colon, Digestive Europe. Like, this is fun. I know that we have people from Asia as well as South and Central America joining today. Next slide. And of course, today wouldn't be possible without the great support from all of our partners, Daiichi Sankyo, No Shave November, Taiho Oncology. Just want to say thank you to all of our industry partners, as well as our private supporters for making today possible, as well as supporting patient education research aims all throughout the year for Fight CRC and this Rally on Research. Next slide. So today, we're really going to be focusing on the patient and the clinical experience. We're going to hear firsthand from our clinicians. We're going to hear firsthand from our patients. We're going to hear, and we're going to have some time, and Elsa's going to talk a little bit about how to use the Hopin platform to see some great poster presentations, some networking opportunities. So this is really about care management. It's about expanding the opportunity for care delivery and really hearing the patient experience and the clinical experience from throughout the world. Day 2 will be focusing tomorrow on research efforts and outcomes. And I just want to say that really today is open for our advocate, survivor, patient community, but day 2 is as well. There's going to be a lot of opportunities to interface with researchers, with clinicians, thought leaders, advocacy partners, as well as policy partners. So stick with us as much as you can today. Join us back tomorrow. There's something for everyone. I know it's a busy time. We've created this Hopin platform to create a really dynamic experience. But even if you can come only for another couple sessions, that's all right. We just need you for part of one day, day 1 and day 2, as much as you can. Next slide. So in the chat, we're going to be providing a poll and really understanding where you're all coming from. Like I said, we have over 30 countries who are represented today. We'd love to hear where you're joining from, get a little information from you. In the poll, in the chat feature, the poll will be available. So all throughout the day, use those opportunities to share feedback. At the close of today, we'll be able to provide who joined and from where. I think that's going to be a great opportunity. But again, throughout day 1 and day 2, we know that we have people from over 30 countries really joining in. And I think Angie said it well. It's really going to take a global approach for us to study and really eradicate colorectal cancer in early age onset disease. So we need everyone around the table. And thank you so much for being here today. Next slide. So Elsa, I'm going to go ahead and turn it over to you to talk a little bit about the functionality, the flow of today. And then Jose and I will hop back in and share some perspective of framing about early age onset colorectal cancer and the current burden. So Elsa, I'll turn it over to you.
Thanks so much, Andy. We're so excited to host this virtual symposium in Hopin and so glad that you all could join us. We're really excited to be using Hopin because it will provide many opportunities to interact with your fellow attendees and speakers. So I really encourage you to explore and check out all of the features that it has to offer. So here's just a brief overview of the different areas of the event. In the stage where we are now is where we'll have all the main stage presentations, all those main panels. Join us as well for the session area. That's where today there'll be the advocate poster presentation highlights and question and answer period happening in between the two panels. And then tomorrow, that is also where all of our breakout sessions are going to be. And there's something for everyone, so many different topics. So I really, really hope that you all will join us for that as well. Also really excited that we have a networking opportunity. So head over to the networking button in the panel and you can do speed networking with random attendees, meet new connections, and get to know people from all around the world. And then finally, we have our expo area, and that's where you can explore all of the abstracts and poster presentations, and we have many other resource booths as well. And then I just wanted to point out a few other features of Hopin as well. So you might see there's two different tabs, the event tab and then the stage tab, and that will update to session if you're in a session, for example. So for the chat, use the stage or session chat when you're in a particular panel to get messages to those panelists, and use the event chat to speak overall with all attendees and talk about the event overall. Also the poll is in the event tab. You can send direct messages to fellow attendees, speakers, as well as the Fight CRC staff. If you need support, message Fight CRC support for one-on-one help, or any of the other Fight CRC staff members. And the reception area also has some tips. And finally, the recordings will be posted on fightcrc.org/rally. So now, Andy, I'll turn it back over to you to share a little bit more about the impetus for this event.
Excellent. Thank you, Elsa. So I just want to say, as I get ready to start out today, working with Fight Colorectal Cancer to advise around education and patient education and researching have actually been really the highlight of my career. I often talk that the early age onset movement is amazing in terms of the number of people who are really devoted towards working to understand the causation, to look at better quality of life, treatment, better access to care. And I just want to say, working with Fight CRC has been an amazing opportunity. I'm going to frame up some of the data that really is helping us think critically about early age onset. I think we'll frame out nicely, pass it to Jose to share a few things as well in terms of the data, some research he's working on. And I think really hearing Jose's leadership and really thinking about from his vision of this international symposium, being the one who really helped, I think, look at that collaboration and that bridging opportunity, really hearing from Jose about where we're going for the direction of the next 2 days and how that's really going to help catapult us into further work. So I'm going to go ahead and get started. Next slide. By just sharing that, of course, many of us know, and I guess, of course, the reason that we're here today is that we're seeing a dramatic increase in the number of young people. As Angie stated in the video, people even who are in their teens, in their 20s, 30s, and 40s at the height of life, really being diagnosed with colorectal cancer. This is actually almost up 45% from what we saw in even the 1990s, which wasn't that long ago. I think 10 years ago, we thought maybe it was an anecdote, a blip on the screen, but globally, this has become its own sort of epidemic of sort. So in really taking this serious, we know that a number, of course, the number of cases for colorectal cancer in general are also quite high, being the second leading cause of cancer death in the US, the third most common, very common statistics almost globally. But there's a number of increasing number of early age onset patients is very, very troubling. So that's what we're here today. I mean, this is what's driving this. It's what we're going to really delve into. And we really need to tackle this from a multi-pronged approach and a global approach. So in terms of looking at the predictions, based on data coming from the AACR, I think one of the biggest issues when we're thinking about that rate is over by 2030, colorectal cancer in young adults from 20 to 49 is expected to be the leading cause of cancer death. This is surpassing breast cancer. And when you look at the number of overall cancer survivors and people who are going to be impacted, that's not an anecdote anymore. That modeling suggests this is a real issue and why we have to tackle now. The urgency that Ann Zauber talked about, Nancy, many of the advocates, the time is now. Next slide. And when we think about global, this rate really shows that we're looking at in most developed countries, Europe, Australia, North America, we're actually seeing some of the highest rates and most dramatic increases in early age onset. Some of the lower rates are in Africa and Asia, but seeing even some of those rates continuing to climb. So ultimately, we know this is still about an even distribution in terms of early age onset, in terms of who it's impacting, just like it is for older adults. But again, the data is still really emerging. So one of the things I want to say is that at times people say, the overall numbers are lower as compared to older adults, and that is true. But that's part of the reason why we need a global consortium to really study this, is because that rate that it's happening is really troubling. But those overall numbers, we're still going to need a global approach for study design, research proposals to really kind of get the number, the powers to be able to say something about maybe causation, as well as some of the indications about why this is happening. Next slide. So in terms of some of the more recent findings, even on the developed countries, we do see Germany, the US, Canada, UK, Denmark, those listed across North America and Europe, as well as Oceania. We're also seeing, while older adults are stabilizing in terms of the number of cases that are diagnosed, we're ultimately seeing younger people diagnosed in those countries. But in some of the European countries, such as Italy, Austria, and Lithuania, we're starting to see a bit of a decline. So as compared to the countries that I mentioned before. So I do think, there's some strategies that we can really look at between countries about what are those indications of what's happening to really look at lower rates and higher rates. But again, that global reach, that global opportunity, global collaboration is what it's going to take and why we're here today. Next slide. And a bit about disparities. And I know that there's starting to emerge more literature and data around like the burden. And I think overall, we're starting to see Black individuals really with a stronger and a higher incidence rate as opposed to white, non-Hispanic individuals. But this is really an area of further exploration. Adriana Halavati, Dr. Jose Perea, who's joining us today, and again, really the catalyst for today's event has shared some great commentary that we really need to look at those biologic differences, looking at exposures and understanding what's happening specifically in communities of color. And this is in the US and beyond, that we really have to start really thinking about equitable care and disparities as well. Next slide. And I think this is one of the things that we're all grappling with, and part of what we'll discuss over the next 2 days is really the why. And I think it's unsettling right now that it's largely unknown. I think much like older age or onset for older adults, those over 45, those over 50, we know sedentary lifestyle, smoking, as well as nutrition can play a role. That's thought that it could be the situation with early age onset. But ultimately, we're actually seeing sometimes very lean people who are very like professional athletes, very involved in their health and wellness, getting diagnosed with colorectal cancer. We still really don't know. So there's some considerations around BMI, weight, food source and quality, and exposures. But this is part of the thing that we're really going to continue to tackle. We put a lot of energy behind this with Fight Colorectal Cancer, and it's something we're going to continue today, as well as some plans moving forward in the future. We've made some great contributions for convening scientists throughout the world to put some study plans together, but this is a work we're going to continue to build off because we really need to get at the reason of why this is happening. Next slide. I think it's really interesting, and I think one of the nurses who spoke in our intro video talked a little bit about people coming in and not being aware of signs and symptoms, and I think that's the patient community as well as the provider community. And through Komodo Health and working with Komodo Health and their claims data, as well as their fantastic data analyst team, we've really looked at some of the emergency room data, and it's really become clear that it's one of the leading places where colorectal cancer is detected. And so I know a lot of times people who are young aren't necessarily always connected to primary care. Maybe it's not on the radar that it could be a sign or symptom of colorectal cancer because of the age. But this is actually something that I think we have to that paradigm change in terms of education, outreach, and making sure that management happens well before people hit the emergency room, where oftentimes if there's bleeding and very strong issues coming, it can be later stage disease. So I want to thank Komodo Health for this sort of data. I think we get data from studies, we get data from different types of analysis of existing studies, but using information like claims data is going to be helpful as well to really see what's happening and how we need to do better education, not just to patients, but providers and the public health community. Next slide. And of course, I think one of the biggest wins we've had over the last 2 years is the USPSTF guidelines, the American Cancer Society guidelines, having evidence and making the movement from 45 for average risk screening to from 50 to 45 years old. And I just want to say that it's amazing that the entire advocacy community has gotten behind this for the movement, but it's really now about that implementation. And we're really excited about what this means and where it's going. Tomorrow, Bob Smith and colleagues will be spending some time talking about population-based guidelines all throughout the world and what this might mean. But of course, I just want to say kudos to this, and now the devil's in the details of how do we get people at 45 in. Next slide. So with that, I'm going to turn it over to my partner in crime, a gentleman who's become a great friend of mine through Fight CRC. And it's funny, we actually met at a research symposium hosted by Tom Weber and team. We were both sitting in the back row with Heather Hampel, passing notes at the time about four or 5 years ago, Jose, I guess. And never would have thought that we would have actually made this strong connection to build a conference like today, to do the things that we're doing. So it's just a rule to say that also the kids sitting in the back row aren't always the troublemakers. So anyway, I'm going to pass it over to Dr. Perea. And Jose, thank you for all of the work, dedication, and really thinking about this collaboration. So I'll have you turn it over to you to share data and to give us our kind of marching orders for the rest of the 2 days in terms of vision and mission. Jose?
Okay, thank you very much, Andy, and of course, thank you very much for your presentation. And of course, a very good friendship since 3-4 years ago, and surprising event in that beginning. So first of all, I want to thank Fight Colorectal Cancer for this fantastic organization and support of this event, especially Andy and Elsa. And to all of the participants, especially, of course, patients and also patients advocacy groups, speakers, moderators, and everyone that makes all of this possible. Next slide. So first of all, just to begin and introducing the background of this event, I would like to remember that this is the 3rd edition of the Early Onset Colorectal Cancer International Symposium. We began 2 years ago in Madrid in person with maybe no more than 60 or 70 participants, including speakers. So, and then last year we co-host the event already with Fight Colorectal Cancer, and as you all know, with the online version, so getting a complete international dimension that has been confirmed with this year's event. So moving ahead, I don't want to forget some of the examples of the advances in research that has been taking place during the last few months, and could serve maybe as a snapshot showing where is or can move forward the research in the field. The first work, one of the most developed topics around early onset colorectal cancer has been epidemiology. So this work from the group of Richard Hayes put together different cohorts and focused in this study specifically on non-genetic risk factors of early onset colorectal cancer. Apart from the differentiation from late onset colorectal cancer, one of the interesting points is that some of the factors, for example, as lower fever intake, were linked with some specific tumor locations. So this may show, again, that as other authors point out, is the possibility that maybe we should categorize early onset colorectal cancer not as a whole, but also with different subset of this type of tumor. Next slide. Other interesting approaches, as molecular, of course, show again differences between early onset colorectal cancer and late onset colorectal cancer. This one from the group of Buchanan shows interesting findings developing genome-wide DNA methylation. They compare different subset of colorectal cancer, an early onset subset, an intermediate onset subset, and also a late onset subset. And specifically, and very interesting, early onset colorectal cancer shows extensive and specific DNA methylation alteration. But not only that, but also more interestingly, that CPGs, so these are specific parts of the genome undergoing aging-related methylation drift, were significantly altered in early onset colorectal cancer. And not only that, but also moreover, this accelerated aging was also shown in normal mucosa from these individuals. So I think this should be keep in mind interesting points in order to move forward in the exploration of early onset colorectal cancer. Next slide. Finally, an issue that is getting a key role, especially in early onset colorectal cancer, and of course is disparities within early onset colorectal cancer. We have the privilege in this symposium to have Dr. Fola Batig, author of a paper in Nature Review Cancer in that regards, conducting one of tomorrow's sessions. So we will see maybe in this session that the need to integrate all the aspects that influence in the disparities linked with early onset colorectal cancer, for example, sex, races, etc., in order to move forward in finding the clues of early onset colorectal cancer problem. In this sense, global approaches in research, I think, are mandatory, as in one of the goals that I'm going to show you of our international symposium. Next slide. So finally, let's try to describe the main goals of these 2 days event. So maybe the first one should be, as Andy has already told, to build a collaborative international network to serve as a platform to raise awareness of this growing problem, and of course, and again, as initiative for the creation of multicentral studies focused on early onset colorectal cancer. Then we will try to get another goal, that is to show the whole reality of the problem to all the communities involved, not only clinician research, but mainly and of course patients' point of view. And finally, and maybe most of them in the second day, we should update the knowledge as well as the clinical management and implication in the patients in order to identify starting points from which to direct efforts to advance the solution of the problem. So next slide. So I would like to thank you very much. And Andy, back to you.
Very good. Jose, I love that rubric because I think you're right. It's really going to take from a societal standpoint to biology to looking at how do we support this work moving ahead. It's definitely that. And I think that today is really built on that, even with policy and a number of things that are also going to help drive. So Jose, again, thank you for your leadership.